making sure that you plan appropriately to go as quickly as you can is really key. So if you think about it, from now, if you were going into a second indication, your clock started of the 9 years for a small molecule on your first indication. Any pushback from any regulator, any hiccup in the data that loses you a year has lost you 11% of the value. So this really does matter in terms of planning, thinking through, understanding what risks you're taking, and making sure that you can pass those risks effectively. So my number one piece of advice for preparation for the IRAs is head out of the sand. Stop pretending this isn't happening. It has already happened. And regardless of whether you build the expertise to understand it internally or externally, make sure you're getting the right advice, because we've always underplanned in biotech and in drug development. That's why our failure rate hasn't really moved very much, partially. But making sure that you are understanding the water you're swimming in, this is now part of that. So making sure that you understand how to prioritize your programs, how to value them appropriately, and therefore how to invest in them. The easiest way to not have an overall hit to the industry where the pricing gets moved is to fail less. So giving yourself the best chance of success for each program, as it always has been and always should be, remains the most important thing to do.